let's talk about some anxiety disorders. This is the first category that we're going to discuss. Many everyday experiences like public speaking, preparing to play in a big game, looking down from a high ledge may elicit what we call anxiety. So in contrast, anxiety disorders are characterized by distressing, persistent anxiety or dysfunctional anxiety-reducing behaviors. Generalized anxiety disorder is an anxiety disorder in which a person is continually tense, apprehensive, and in a state of autonomic nervous system arousal. A panic disorder is an anxiety disorder in which the anxiety suddenly escalates at times into a terrifying panic attack, a minutes-long episode of intense dread in which a person experiences terror, accompanying chest pain, choking, or other frightening situations. Oftentimes, people who are having a panic attack sometimes think they're having a heart attack. That's how intense it is. A phobia is an anxiety disorder marked by a persistent, irrational fear of a specific object, activity, or situation. And in contrast to the normal fears we all experience, phobias can be so severe that they are incapacitating. For example, a social phobia is an intense fear of being scrutinized by others. It's shyness taken to the extreme. An anxious person may avoid speaking up, eating out, or going to parties. And if the fear is intense enough, it can lead to agoraphobia, which is not leaving the house. Other specific phobias focus on animals, insects, heights, blood, or close spaces. Obsessive-compulsive disorder is an anxiety disorder characterized by unwanted repetitive thoughts, which are obsessions, and or actions, which are compulsions. These obsessions may be concerned with dirt, germs, or toxins. The compulsions may involve excessive hand washing or checking doors, locks, or appliances. The repetitive thoughts and behaviors become so persistent that they interfere with everyday living and cause the person distress. And post-traumatic stress disorder is characterized by haunting memories, nightmares, and social withdrawal, jumpy anxiety, and insomnia that lasts for 4 weeks or more following a traumatic experience. Many combat veterans, accident and disaster survivors, and sexual assault victims have experienced the symptoms of PTSD. Some researchers are interested in the impressive survivor resiliency of those who do not develop PTSD, and we're going to talk more about PTSD in just a second. So again, generalized anxiety disorder affects about 2/3 of women, which is it's a very high statistic. And it's kind of free-floating anxiety. There is no one specific thing that is bothering them. They're just continually tense and anxious. And this picture right here is the lead singer of Green Day, and he has attributed a lot of his music to his anxiety, relieving his anxiety disorder. Panic disorders are characterized by panic attacks, which I talked about. Phobias, like I talked about, specific phobia focuses on animals, insects, heights, bloods, or close spaces. Social phobia is extreme shyness, and if the fear is bad enough, can eventually lead to agoraphobia, which is going to keep you in your household. Obsessive-compulsive disorder is a very interesting disease. Obsession versus a compulsion. An obsession is the unwanted repetitive thoughts, where the compulsions are the actions. You have checkers, people who check the lights and the doors and stuff like that, and then you have hand washers, people who want to, constantly wash their hands. And this is Howie Mandel, and he has OCD, and he is a hand washer and a germaphobe. So, PTSD. Let's talk a little bit more about PTSD. Again, this is a disorder in which you have haunting memories, nightmares, social withdrawal, anxiety, and insomnia that follows a traumatic experience. Researchers are very interested in survivor resiliency. What causes two people go through the exact same situation? What causes one person to break down with PTSD and another person not get it? About half of adults experience at least one traumatic experience in their lifetime, but only about 1 in 10 women and 1 in 20 men develop PTSD. And for some people suffering, this can lead to post-traumatic growth. And this includes an increased appreciation of life, more meaningful relationships, changed priorities, and even a richer spiritual life. It's very important that you understand that PTSD can be caused by any traumatic situation. It's not just due to a war situation. The learning perspective views anxiety anxiety disorders as a product of fear conditioning, stimulus generalization, reinforcement of fearful behavior, and observational learning of others' fears. The biological perspective helps explain why we learn some fears more readily and why some individuals are more vulnerable. It emphasizes evolutionary, genetic, and neural influences. For example, phobias may focus on fears faced by our ancestors. Genetic inheritance of a high level of emotional reactivity predisposes some to anxiety, and elevated activity in the anterior cingulate cortex appears to be linked to OCD.